Hello and welcome to you all. Thank you for making time to be a part of our meetup for the month of June. If this is your first time joining, my name is Linda Nsifo, and I am the convener of the Women in RMEL, which stands for Women in Research, Monitoring and Evaluation and Learning. So we are an online community that seeks to accelerate the careers of women in the research, monitoring, evaluation, and learning space. And we are looking out to mentor young women or women who want to venture into this space. We want to also make sure that they are making a difference wherever they are, and also to ensure that people who are developing themselves can also impart or share the knowledge that they are gaining with others as well. So if you're joining, please do well to introduce yourselves, let us know your name, and also where you're joining us from and what you currently do, your profession. Let us know all these details so that we can network better as we go along. So I would like to share my screen to take us through our agenda for today before we dive into the meaty stuff. So permit me to share my screen. Okay, I hope you can all see my screen. Great. All right, so we are going to dive into the topic, assessing project impact through data analysis. And I will introduce our speaker shortly. But before that, I would like us to engage in a short icebreaker. So I'll dive straight into the icebreaker. So, since this is meant to be a very global meeting, I believe that there are a number of us, or we are all representing different countries. So it would be interesting to know what your favorite food or meal or dish is. And personally, I'm someone who likes to meet people from different countries. So if I happen to visit your country, of course, I would like to taste your meal or your food that is common there. So if you want to share your favorite meal or dish, you can do that. But it doesn't necessarily have to be one that is specific or peculiar to your country of origin. Okay, anyone wants to share? You can unmute yourself if you want to share what your favorite dish is.
Sure. I would like to share. Um,
Sure.
so my favorite dish is from the coastal region, from Kenya, uh, and it's chicken biryani. It's
Mm.
really very spicy. Uh, well, so sometimes too spicy, but I I love it still. And it comes with some sauces where you can and tamarind sauces
Yeah.
uh, that you can eat it with as an accompaniment, and also some juices. It's really nice. When you come to Kenya and to the coast someday, you might want to try. And my name is
Nice.
Constance.
Sure. Thank you so much for sharing, Constance. I've actually had chicken biryani. I personally enjoy it too. Anyone else wants to share? Feel free to share. Okay, while people are thinking, I can share mine. So I like a food in Ghana popularly known as waakye. So it's spelled Waakye. So it's a very interesting dish, in the sense that it's got a lot of ingredients. So there's the black-eyed beans, then there is grated cassava, which we locally call gari. And then there are some proteins as well. So you can decide to have an egg, you can have beef, you can have chicken or sausage or even fish. So I personally like to have my proteins that I like to have are egg and fish. And then you can have some greens as well, so some vegetables. Some choose not to, but personally, I like to have vegetables included. And then you can also decide to have spaghetti as well. Yeah, so I think it's a pretty balanced meal. And of course, you can have hot pepper sauce, which gives it that spicy feel or taste. And then you can have like a normal stew, um, yeah, or red sauce to go with it as well. Yeah, so that's my favorite dish. Anyone wants to share in the chat? Do we have any who want to share? Otherwise, you can share as we proceed. Because of time, I will end the icebreaker activity here and introduce our speaker for today. Okay, so our speaker is in the person of Constance Nganyi, and she is a monitoring, evaluation, and learning specialist with extensive experience in designing and implementing MEL systems across a wide range of public health and development programs. She has led data-driven evaluations and impact assessments in areas such as adolescent sexual and reproductive health, reproductive maternal child and health, malaria, non-communicable diseases, WASH, and telemedicine. Her work spans routine data systems, strengthening, let me take that again. Her work spans routine data systems strengthening, cross-sectional studies, capacity building, and the development of tools that translate evidence into actionable insights. Constance is passionate about using data to improve program performance, accountability, and sustainability. She brings a strategic and adaptive approach to learning, ensuring that evidence is used to drive meaningful impact in communities. All right, so that's our speaker for today. Constance, you're welcome. Thank you for making time to be our resource person for today. I'll hand over to you, please.
Thank you. Thank you so much, Linda. It's so great to be here. Um, Welcome, everyone. And I look forward to hopefully impacting us with the knowledge and also learning from each one of us. I mean, meal is all about you learn every day. You never stop learning when you're in data anywhere dealing with data, monitoring and evaluation. There's plenty of learning every single day and in every project. Okay, so for today's presentation, I'm going to talk about assessing project impact using through data analysis. So I'll just go right away and share my screen. Right. Just give me a moment, please.
Sure.
Yeah. Okay. I hope you can see my screen.
Yes, but we can see your notes. I don't know if you
Okay.
want to,
All right.
in the initial
Okay.
view was on point. Okay,
Okay.
looks good.
That okay. All right. So, just like I said, we are our topic today is assessing project impact through data analysis. That's what I'm going to take us through today. And our objective, just to take us through our objective, we only have four main objectives, and we want to understand what impact really is. And then we also want to identify the right data for impact assessment, um, and also explore tools and methods for analysis. We are going to be mentioning a few just because of time, but also give pointers on which others that we can be able to look at later. And then finally, we will learn to translate data into stories of change, which is mainly impact or what do we want our data to tell us? Okay. Right. So our biggest question is why? Why do impact assessment? Yeah, and you find that so many organizations put so much funding into several projects, several interventions, and you mostly find that what comes out of it is the activities, the outputs that are being measured. But then beyond outputs, we don't really see the impact beyond that. So only 30% are able to measure the impact, and the rest usually mostly struggle to show what the impact of their work has been. And this could be because of funding and maybe other aspects such as lack of capacity. And so that's where now we come in as male experts or male during the last presentation from our last presenter, we learned about we saw different types of different phases of monitoring and evaluation. We started monitoring evaluation, we went to monitoring evaluation and learning until we included accountability and research even at the end. So that's why meal is very important, so that we're able to address impact or assess the impact of what the projects have been doing. So you find that the traditional measures that have been used usually capture the actual value creation, but they fail to assess what impact really um, uh, the impact that the project is making. And there's been increasing demand from stakeholders and donors and even communities to see what the proof of return on investments and meaningful outcomes that come from the projects and even interventions that are being implemented. And that's where now we data-driven impact assessment comes in to transform project management, and just we shift our focus to results and not just reporting on activities alone. And we now move from just counting the number of activities or outputs that we have and measure real impact that the project has to the beneficiaries at whatever level, whatever project that you are doing. And this presentation is actually as I am I forgot to introduce myself as well. I mean, Linda has already introduced me, but I would also just like to add that I've mostly worked in the public health sector for 8 years now, but right now is when I've just shifted and focusing on advocacy, using monitoring evaluation for advocacy at an organization based in Nigeria called African Queer Youth Initiative. So for this presentation, for the purposes of this presentation, we are going to see how it's going to be applicable to all sectors, whether it's agriculture, finance, public health, and all other projects that you might find yourself working in. Okay. All right, so let's look at impact measurement frameworks. And when we look at impact measurement frameworks, we are mostly looking at TORs, and our TOR should be very clear on what impacts need to be, what impact and outcomes we need to target or need to be achieved. And apart from that, we need to be able to see for your framework, we need to be able to clearly outline indicators for each at each and every point, at inputs, activities, outputs, outcomes, and impact, but mostly prioritize the outcomes and impact as well whenever you uh, creating or developing your indicators. So the theory of change will clearly map the interventions, and then you design the indicators at each level, just like I said, and now prioritize impact. So for example, looking at this example of intermittent treated nets, the input is this program is giving an input of $50 million US dollars into the program to achieve the output is to achieve 80% ownership of ITN or intermittent treated nets. But then what's the impact that we want to see? We want to see an impact of a reduction in malaria cases or malaria incidences at 40% reduction. So all these other metrics help us to measure the final impact or what the end product of what we want to see the project achieve, which is a reduction in malaria incidences or malaria cases. So we cannot say that 85% ownership is an impact. That's not an impact. It's just helping us towards achieving the impact. And neither is 70% use of mosquito nets is an impact. That's an output or an outcome, if you may, that's helping us towards achieving 40% malaria reduction or malaria incidences. Right, so let's look at the data sources for impact assessment. What are some of the data sources that we can use to assess impact? And when we are saying some, I'm saying some here, but we should really put in mind all data sources. In your projects or interventions that you're working with, all data sources are very important towards assessing impact. And when we start with, at the very top are routine monitoring tools. And these could be the in-house monitoring tools that have been generated at organization level or a project level. And then you could be using Excel trackers, you could be using information systems such as, like in the case of public health, we use DHIS2 a lot. There are other, perhaps I'm not quite aware with any other routine monitoring tools in other sectors, but I'm pretty sure you do have in your project, you do have them, the ones that you use for routine monitoring. So those ones are very important sources when it comes to impact assessment. We use them later on to assess impact. And then, okay, someone is just, okay, need that. All right, then the next one is project evaluations. This could be surveys, baseline evaluations, midline evaluation, endline evaluations of the projects are very useful as well in assessing impact, such as baseline evaluation. We will use that one if we want to do analysis of where the project started and now where it is right now. And midline evaluations or assessments also help us to know how the project is going. Are we heading into the right direction into achieving what we want to achieve, towards achieving that impact that we said that we wanted to achieve. And then evaluation now, we basically compare what the project has achieved versus what we intended to achieve, and also where we came from. We have mobile data collection platforms also for data sources, and this could be among them Kobo, ODK, Comcare, whichever you use, Survey CTO, whichever data collection platform that you use for survey, for data collection, all those are very important when it comes to impact assessment. And this is one data source that is often not being explored much or leveraged much. Community engagement tools, getting feedback from the community scorecards. Since as we all know, data, just numbers alone can be very cold and cannot tell us exactly what it is that it does not give us the why, the so what of the project. So it just gives us the what. Yeah, but the why is usually very hidden, and community engagement tools such as feedback from the community scorecards usually gives us more insights into what the project has achieved, and it complements the quantitative data that we get from routine monitoring, from mobile data collection, surveys, or tools. So community engagement is a really, really important aspect of impact assessment, as it also um, it gives us or brings in the aspect of human-centered design, such that we are not just reporting numbers, but we are giving lived experiences into our impacts assessment and even reporting. We'll see that in the next slides that are coming up. All right, so let's talk about turning data into insights and what kind of tools or analysis that we use when we want to now turn data, just raw data into insights. We can use trend and time series analysis to compare when the project started and when it's ending. How have we so far, what have we achieved, and how far have we come? Yeah. And then we also use before and after comparisons. I talked about this before when we were looking at baseline project evaluations, looking at baseline evaluations, midline evaluations, and also endline evaluations. So these are very, very important when it comes to turning data into insights. You also have outcome mapping, where you go, it could be outcome mapping and also harvesting where you go to the your project beneficiaries, and conduct surveys to apart from mapping outcomes, you also harvest the outcomes, talk to your beneficiaries, and get to know what how has the project benefited them, yeah, and have them give you human stories, stories that you could later use as quotes, and even use photos to even put in your reports when you're reporting, when you're using or when you're including donor reporting. You could also put in those photos the uh, quotes that you've gotten from the community. It could be beneficiaries at community level. It could be in my case, or for those who are in public health. You could also get insights from healthcare workers, and also at a higher level from at the state or county level, national level. They could also give you what they think, or tell you what they think about what the project has done so far in terms of towards uh, achieving the impact that it was intended. And then we have thematic coding that is for qualitative data. You could use multivariate regression analysis for that. You could also use some correlation and analysis to just test correlation and test to see if exactly what your data, the raw data that you got, the numbers are matching, um, uh, or matching and giving, the stories quite aligned. There's some sort of significance into the stories. Yeah, and then we also have using dashboards for data visualization. And for dashboards, we have so many, the use of AI, using AI has been really isn't our work in terms of showcasing our impact. So instead of just having um, an Excel where you cannot be able to really share, or when you share, it's just numbers. Turning that into visualization will really help people to see. I never knew, just to share, I never knew that people never liked numbers, just because I like numbers. I like to deal with numbers, even in my daily life, even at home. I'm usually working with what time am I going to be finishing this? I need to, uh, working with numbers all the time. And I realized that uh, people don't really like numbers. But when you put pictures, when you put the visualizations, the dashboards, the graphs, the pie charts, people really get interested in trying to understand or to see what exactly you want them to see. And it's also easier to tell a story when you're using data visualization. So one key thing about data visualization, you need to make it as simple as possible, because as I said, not everyone likes numbers. And when you put so much variables into it, it could become confusing. So if you have, for example, like a what do we call it? A line graph, just one line is enough. Okay. And if you're comparing, perhaps comparing two variables, have them in two separate charts as well. So that will really help into communicating the insight, or what you want your audience to know about the impact of the project that you are doing. Okay. Right. Then, what are some of the common analysis challenges that we normally experience when assessing impact? Yeah, there's attribution problems, where when you have multiple interventions. So, for example, let's talk about USID or USID PMI program, where we have several malaria interventions. We have they use interventions that are measuring the use of ITN, or I'm sorry, I'm using abbreviations, the use of net use in several all over the world, there, if I may say. And also there are others that are assessing malaria in pregnancy. There are others that are assessing malaria care and treatment. So we have all these components of PMI, or President's Malaria Initiatives, that are all geared towards reduction of malaria incidences. And we also add another component of social behavior change, it now becomes even more confusing, if I may say. But then how do we make sure that all these four interventions are able to align or synergize, and give us what we are looking at, or what we really want to see, a reduction in malaria. So um, attributing and attribution and contribution analysis really does help when it comes to that. So you take, let's say, for example, if it's the project that was, or intervention that was working on malaria, on reduction of malaria through mosquito nets, and look at social behavior change towards a reduction of malaria cases. How has social behavior change influenced the uptake of mosquito nets towards reducing malaria? So you see, when you attribute those two, you're able to at least see how those have been working together towards achieving one common goal. And then we also have selection bias, where selection bias here, I'm talking about the kind of analysis tools that you'll be using, or analysis methods that you'll be using. So if you're using comparison or attribution analysis, or multivariate regression, uh, something like that, some analysis methods or tools might be better off with some interventions, and some might not be. So it's always good to test the tools that you're using, and also have external validation from external, not just within your organization, but also from stakeholders. Let them see what you are analyzing, if it really does reflect what we have. For example, in the national strategic documents that we are that have been put in place, are they reflecting what they need to be able to achieve in that sense? So looking at and then sometimes you might want to incorporate all these analysis tools together. So you might want to do a comparative analysis, and you do regression analysis, and combine all those, so that you're able to uh, really see, or get the why, that or the meat into what your data is telling you, what your red raw numbers are telling you, or metrics are telling you. So selection bias is quite a big problem. But with time, as you understand the context of your data, or the context of your intervention, not data, the context of your intervention, you'll be able to select the best analysis tool or analysis method to be able to showcase your impact. There's also data limitations, such as missing data, having small samples, and poor quality data, which can be addressed by conducting regular or routine data quality analysis. When you do that, data quality audits or data quality assessments. So when we do that, we are able to at least address the issues of missing data and small samples, and also data quality as well. I don't know if there's any questions so far in the chat.
Not yet.
Okay.
Yeah, but I've notified participants that they can do so as you go on with your
All right.
presentation. Yeah.
Okay. Okay.
Mhm.
Thank you. Just feel free to even unmute yourself and ask questions if you have any. Right. So for impact assessments usually begins with data collection, and you will not have great insight if you do not have correct data or quality data. So some of the best practices that we need to consider when collecting data so that we have we have the best impact and also accurate impact assessment is combining system generated metrics with survey based measurements for comprehensive quantitative data. So this is what I was saying earlier, when you need to at least use several data sources to be able to see into analyze and compare your data from different sources, and also just validate. Yeah, it helps you to validate your data, and also just make sure that everything is aligned when it comes to data. And now when you're doing now your insights generation or impact assessment. The other thing is integrating qualitative methods. So apart from just using the system generated and survey based measurements, integrate qualitative methods. So things like focus groups, interviews will help you to know what the why, the so what, and not just having numbers, cold numbers that are just there looking at you. This one will help you give some more a story to the data, help you craft a story. Those quotes that you get from community, from a beneficiary, say a pregnant woman tells you, I've been using the net since when I got my second pregnancy, and I've not had any miscarriage. I think this net is very important. It's working, and I do not, mosquitoes are not bothering me anymore. You see, now that's uh, showing how effective the program is towards reducing malaria or malaria cases using mosquito nets. So that proof of evidence from just this little story from this pregnant mother can add so much more onto the data that you already have. Okay. And then there's also conducting routine data quality assessments, RDQAs. Yeah. Uh, Helps you to make sure that you have the best data or quality data when assessing your impacts, or now getting your insights. And then leveraging technology tools and even AI also helps us. Nowadays, we have so many. Python has made it even easier for data analysis. If you are using, Python, or are using Python already, it could help you very much in towards generation of insights as well. For statistical analysis, we have things like statistical tools like Stata, R. We also have SPSS for those of us who are still, in the back here, we've not quite adapted yet. So those are really very important tools when it comes to data collection and also analysis. I've mentioned data collection and I've mentioned data analysis as well, so we can also still add it right here on this list. Okay, so looking at now our no, we want to now visualize or report for impact, yeah, and impact. We don't just assess impact without communicating it. We don't assess impact and keep it to ourselves. We assess impact and communicate, disseminate information for future improvements. Yeah, so how do we do this? We use executive dashboards. So executive dashboards are very high end. I'm sure some of us have perhaps encountered some executive dashboards, especially in the finance sector, where they perhaps they can just show you how investment has been in a country, perhaps the GDP, how it's been, and from there, what are we looking at? Or now where they now use prescriptive analysis to now showcase what could happen, what we could expect in future. We also have the use of effective visualization. I've mentioned this before, but just add emphasis that effective visualization is very important when it comes to reporting. Imagine a narrative report that's just has just words, only words, nothing, no visualization, no graphs there, no tables to show what exactly like to complement what exactly we see on the report or we read on the report. So visualization, it will be very effective to help your audience get glued onto your report and even expound or make them understand your insights even more. So when they see a graph, you say that there has been an increase, and you show a graph, a line graph that has an increasing gradient, then that shows them it brings the aha moment, like, oh, so this is what they means, what it means that to have increased from point X to point B. Yeah, and they see now over time how has it been, or through trends, how has that trend been changing. And then we need to also have well-structured reports for impact communication, a report that has an executive summary, a report that has the methodologies used, a report that has a discussion or discussion, and also a report that has conclusions. And also, most important, we usually forget to include recommendations in our reports. Recommendation communicate impact at a very greater level in terms of telling your audience what you have learned. Recommendations, and even if you have lessons learned and success stories, and also best practices, also include them during your impact assessment. Those will really help even in future projects, and also for those projects that are still underway that could benefit from the mistakes and challenges that you went through and how you overcame them. So those are very, very important and could also be used for future improvements. And the next one is you need to also tailor your communication to different audiences. Sorry, audiences is missing there, but you cannot use an executive dashboard, for example, and present this executive dashboard to a community at a community setting. So, say for example, in a healthcare setup, we have a community meeting. So we have community healthcare workers meet routinely to discuss how their activities have been going and what they've been able to achieve so far. So having an executive dashboard will not help them to see exactly or expound more onto what is it that they've been able to achieve. It will be more very confusing, and it will take a lot of effort for them to be able to understand, or even just um, uh, yeah, to understand. So you need to give them bite-sized information that really helps them at their level, the ones that they really need to know. Not all information needs to go to each and every audience. You need to see how you filter the information, and also not filtering in terms of hiding, no, just making sure that what they are focusing on is what you report to them. Um, and also report to them in a very easy way to be able to understand bite-sized information that they're able to understand. And I'm speaking about now beneficiaries, community beneficiaries here. Bite-sized information that they're able to understand helps them to see that yes, for real, this project is really helping us. If this is what they've been able to achieve so far, then it's really helping us. And they can even give you more feedback. What I was mentioning at the beginning, community engagement, feedback forms, or sometimes they just give you feedback without even you asking. So they give you feedback and tell you, oh, by the way, to just to add on to what you've said, I've really seen this working here and there. So say, for example, if they were using a water filtering system, and they say, it's really helped me right now. Uh, I'm drinking water that is very clean compared to what I was drinking previously, and it has changed my diet. I see my skin is glowing. Perhaps they could tell you that, or they can tell you it has improved my cooking, and you can use this. You take this and then add it to your impact reporting on the next report that you will be reporting to your donors, or even beneficiaries. And also using this information, you could use that information to scale up to regions that the project has identified that need the intervention as well. We also need to translate statistics into human-centered outcomes. I think I've already mentioned this previously, but just to add that human-centered design is or human-centered outcomes really are very important. The many projects, be it business, be it health, agriculture, are really looking at what's humanized in their projects nowadays. If they do not see how it's impacting the people, and just and how it's addressing the what the concerns of the people, then it won't be of any, people won't give it as much um, value or attention that you might want, the attention like you might want to get. So bringing a human-centered design into your communication, or your impact reporting, your assessment, your data analysis really helps to ensure that you connect with your audiences. I've just put a snippet of a dashboard that I was creating for a previous project, adolescent AYSRH, or adolescent and youth reproductive and sexual health, in my previous work with USID. And this is a dashboard that I will present to the youths, the peer champions that were conducting their activities or implementing the activities on the ground. So telling them how many Binti Shujaa in Kiswahili, that's Kiswahili for um, um, a girl who is a hero. Yeah, a girl who is a hero. So showing them how many girls they've been able to reach, how many they've been able to enroll in a certain period of time, how many have been able to return to school, and perhaps those who have been able to involve themselves in different activities. And the referrals that they've been able to make over time really did help them see that it's true that we are really doing a great work, that the work that we are doing is not in vain, and then go further and tell them, disaggregate the data and tell them, this is the range of the girls, that age range of the girls that you've been able to enroll so far, and perhaps give them more insight on where else they need to focus more, and where they need to perhaps focus less. Okay, now this is to put this here. So this is, I just wanted to show us some of the presentations or data visualizations that I've been able to use. And also I mentioned attribution analysis. I just show you how that works using these three two graphs and this screenshot that you're seeing here. So up here on your, I don't know whether it's your right or top left. On my top left, we see the numbers, the raw numbers of pregnant women who came and who came between 2021 and 2022, who came to the hospital or to this dispensary or health facility in Kenya in 2022, and showing us the new clients, and those new clients, how many were able to complete for antenatal care visits, which was the target, or which is the target for the project in many projects as well. And then how that one now translates to how that one helps us to see in terms of malaria pregnancy or reducing malaria cases in pregnancy using intermittent preventive treatment for malaria. So the more the women come for, or the more the women, pregnant women, the more pregnant women who complete their fourth ANC or antenatal care visits, the more we see the number or the doses of intermittent preventive treatment being taken by them. So when you see, for example, in quarter 4 of both these two graphs here, and this is going against the um, recommendation that I gave you, that your graph should be as simple as possible, especially this lower one. Ideally, I should have just not included the bar graphs because you already have them up there. But now, just looking at the other aspect of intermittent, let me call it IPTP, since I've put it up here. So those clients who are taking IPTP were, if you look at those who are finishing, or the numbers that came throughout the quarter, if more pregnant women attended the clinic or came to the dispensary in that quarter, you see even IPTP uptake during that quarter also increased. So looking at quarter 4, you see what translates quarter 4 on the first graph. You see it translating on the second graph, where we see the doses going up and also going up over time. And especially looking at IPTP3 and IPTP2. So and then we have a survey that was done. It's called Malaria Behavior Survey, and it's been done in so many other countries. But this is specifically for Kenya, because I'm in Kenya, and this project was done in Kenya. So when you come and look at what the malaria behavior survey is saying, which is mostly qualitative data, is complementing the use of IPTP and also complementing the use of increased use of IPTP and attributing that to increased attendance of pregnant mothers to for their antenatal care clinics or antenatal care visits. So you see that here the average women who are taking IPTP at 3 doses is 48%. When you look at overall, when you just estimate the IPTP coverage, it was also just when you estimate, it's also just between 45 and then 50% there when you do um, amine analysis. So it tells you that it's true that what we are getting, the data sources that we are getting from this health facility truly reflects what we have been able to, what the community has been able to tell us during this survey, this malaria behavior survey. It's true because it's a behavior survey, we are assessing their behaviors towards seeking malaria services. And yes, it's true that it's telling us what we are seeing or the data that we are seeing at the clinic is not lying. Okay. All right. So some of the lessons that I've been able to learn in my journey in using data analysis for impact assessment is always plan for impact from the start. If you don't get your theory, your TOC theory of change right, you have to get it right from the start. If you don't get it right, then your data collection, your data analysis is going to be messed with, or is not going to be accurate as you would want it to be. Yeah, it's going to be very misleading. Um, and also you need to build mail or mail into every project phase. Let's not forget accountability that we also just learned in the previous presentation. Let's include accountability in there as well. We need to also make sure that our data is user-friendly. It can be accessed. Those dashboards, you need to make sure that you train, you capacity build your team, either your project staff, the at county level or at state level. You need to ensure that people at working with the government organizations are also able to access it when they need it and are also able to navigate the dashboards or the data whenever they need it. They don't have to come looking for you every single time to give you the data when it's data that should be readily accessible. We do also need to prioritize adaptive learning. So adaptive learning is where we take the success stories, we take the best practices, and we keep on bettering each and every step through. We can do feedback reviews, yeah, to get feedback from participants, from beneficiaries, so that it helps us into reporting or assessing impact the next time. We need to also include stakeholders during validation, and even at the very beginning, they need to own the process and also own the intervention. So if your stakeholders are in it, 100% in it with you, you'll be able to get a very easy time. One of them in areas including getting feedback. When you go to the community to get feedback, because you already presented this project to them from the very beginning, it becomes so easy for them to give you feedback towards improving your project or towards assessing how the project has been impactful to them. But if you do not have that, then you'll have a community that does not understand what you're there for. And perhaps if they'll now start asking you, what do we get in return? But if a community already understands, then it becomes so easy. Stakeholder validation is also very important. At national level, we have strategies that are that we normally projects normally need to align with. And if you involve stakeholders from different sectors, government, private sector, social enterprises, it becomes so easy to be able to collaborate. And also uh, uh, in future, when you're doing, let's say, a coverage evaluation survey, it becomes very easy for you to integrate other people into your assessment efforts and get very accurate and very good data for you to be able to disseminate information when it's all when your project is all over. So at that point, I would like to invite you to ask questions. And even as you ask questions, let me just check. Yeah, as you ask questions, I would also like to as this question, I also like you to look at the data that you have. Have you the data and the data sources that you have? Are you now able to look at that data and assess impact? Is there something that you've not been able to do, or whatever I've mentioned that you've been not been able to incorporate when you're doing your analysis to be able to assess impact or bring out the aspect of impact in it? And are there stories that you can also include in your data or in your reporting when you're reporting impact to your donors, to your beneficiaries? Are you able to include human-centered stories so that you're able to connect more with them, and also just make sure that you're communicating the impact in a humanly possible way, using quotes, using success stories, um, yeah, things like that. So, um, welcome. If you have any questions, please, or any concerns, um, I'll be happy to address any. I hope I did not take too
All
much time,
right.
Linda.
Well, we've gone a bit beyond, but it's all for a good reason. So don't worry
Good.
about that, Constance. Yeah, the topic is interesting, and personally, I've learned a lot. Because where I work now, we are actually engaging consultants on an impact analysis study, and there are some things that I can relate with, as you presented brilliantly in your presentation. Yeah. So the
You.
floor is open. So participants, you're welcome to ask your questions. If you have anything that you need clarification on, please feel free to share. You can type your questions in the chat, or you can also unmute yourself and you'll be given the opportunity to ask your questions. So, any questions, any comments, any add-ons, anything that anyone wants clarification on? This is your time.
Uh, working with so many people at different levels, whenever there's silence, it means that we are told it means that the presentation was good. Either people totally understand or people did not get anything. So, uh, so guys, it will be really good if perhaps if you have any question at all, or perhaps you like some resources as well, I could also share resources if you need any. Yeah,
Okay, maybe while our dear participants are cooking up their questions, I will
maybe.
start. So this is based on experience and actually something that we have been discussing at my workplace. So it has to do with this issue of contribution and attribution, because we have multiple funders, and each of these funders, well, some are more particular about this issue of contribution and attribution because we have one particular funder that wants to know how their financing or their funding has enabled. So we support projects. So where I work, we support projects. So essentially, we receive the funding from the funders, and then we run the, implementation of these projects from afar. But then there's another aspect of our involvement with these projects where so we actually monitor their work, but then they actually do the groundwork, so to speak. So then we have to report to the funder, and they always want to know, or this particular funder wants to know how much of their funding has enabled these projects to report progress on, like, the various indicators that they are required to report on. They want to know if all the funding that they've provided has yielded X results. And we've also gone to the extent of actually providing some information on whether some of these projects had received additional funding to enable them to carry out the activities as well. So it can be a bit tricky because sometimes when we are onboarding these projects, sometimes for them, it might also be challenging to really say this percentage is what we are reporting on based on the funding we received from funder A, or this is the amount that this is what we are reporting on based on what we received from funder B. Sometimes all the results are lumped together, so that distinction can be a bit challenging to determine, especially from a MEL point of view. You might just take all the results and reports to either funders if it's a project that has like multiple funders all expressing interest in the same project. So yeah, as a male person, like how do you navigate that, or how do you have those kinds of conversations with the projects right from the beginning? And sometimes they might not be noticeable at the beginning. Maybe you become conscious of it based on a follow-up question that a funder might have raised. Um, yeah, as part of their routine checks or like usual calls with the project implementer or whoever is more or less like the link between the projects and then the funder, which is essentially the organization or the category of the organization that I work for. So just wanted to hear your thoughts on how to navigate that as a male person.
Okay. Okay. Thank you. Thank you so much for that question. Um, if perhaps I've understood your question well, is you uh you're looking at, it's a financial, you're reporting on financial metrics, or the finances that are being used for different projects, and
Yes.
and you and
And
you
then
want to.
people reached like that number of indicators that we ask our projects to report on. There are some that are like mandatory that run through all the projects, but then there are some that are applicable to the projects based on what kind of project they're doing.
Yeah.
Because we do have some indicators that are more people focused. There's some that are focused on the environment, and there's some that are more focused on finances. Yeah, and then knowledge products and policies and things like that. Yeah.
Mm. Okay. So I think for that's quite I've been able to encounter that, but not entirely. Um, um, how would I put it? I've been able to encounter it for different project interventions under the during my previous employment, and even right now, uh, where uh, money comes in from different donors, and they want to for you to attribute how much has been spent where and what has been able to be achieved. But then you find that sometimes you're doing those projects all together without really um, separating, separating that. And I think for first of all, best practice is to be able to work be very intentional in terms of your budgeting, looking at incorporate both budgeting into your meal activities. So when you're coming up with your meal framework or your M&D plan, you need to make sure that those budgets are properly allocated for each and every activity that's going into each intervention. Okay.
Yep.
Then that way you'll be able to at least narrow it down. And even though um, um, we've had donors who are really very so happy when they hear that we've been able to use funds from a different donor
Okay.
to implement this their activity or an activity that was uh, impacting or
Mm,
an outcome that we would address the problem that the intervention is seeking to solve.
mm,
And for them, how we will report that, we will report it as cost cutting, being cost
mm,
effective. So
yeah.
if this intervention is able to address the same issue that
Sure.
this intervention is addressing,
Mm-hmm.
then that's we are what there's a term that we used to call it. But yeah,
Mm,
it's I think it's evaporated. But yeah,
yeah.
putting it as being cost effective when it comes to your reporting, cutting
Mm,
cost and even integration
yeah.
makes it look more like working together
Mm,
than now uh, uh, them being confused about where did our funds go. But then
mm,
you might also have to ensure that if we did to ensure that you report where the funds were used, if
mm,
they were not, if you had another intervention addressing the same issue or problem that this intervention two, or let me call it innovation two, is meant to address. So
yeah.
I hope I've tried to answer your question.
Yeah.
Yeah.
It's in order. Thanks. I
Okay.
saw a hand up. I think it was, let's see if I can find the person. Oops. Oh, okay. It looks like the person has left.
Maybe they dropped off.
Yeah. Let's hope that he or she comes back. Okay, so there's a question in the chat. Is it possible to undertake impact assessments on projects, example, political projects on which baseline studies do not exist?
Mm, okay. So, I would say yes. It is possible to conduct impact assessment even when you do not have baseline studies. And how this is possible, there are some other, we talked about other sources of data. So if you do not have a baseline, then you can work with uh, looking at where the project started. So I'll give you an example with social behavior change for malaria. And social behavior change for malaria was a totally new project that was introduced by USAID globally. We had no baseline at all. No survey had been done on social behavior change. So what we were able to do before doing a baseline, before doing a survey, when we started implementation started around April 2021. Yeah. So what we had been doing, the impact that we had been assessing uh, uh, for the 5 years that the project was running, was we were comparing when the project started and where we were at. So that's how we were assessing impact. And then just apart from that, going to using feedback from the community, getting feedback from the community, from beneficiaries at community level, healthcare workers at facility level, and even stakeholders at national level would also give us uh, uh, their feedback and also insights onto how effective has SBC been since we introduced it. But then also just to add, it's also, apart from that, they were also able to give us the challenges, yeah. Because it had a lot of, if it's something that does not have a baseline, a lot of challenges would be encountered, and they were able to at least help us to capture those that we were not able to. I hope I've answered your question, Donald. So you're free to use to compare just at the start of your project and where you are at right now, or when the project ends.
All right. Donald, you can confirm if your question has been answered. Okay, is there one more burning question from anyone? Do I see any hand up? Okay, it looks like we don't have any. Okay, Donald says he is satisfied. Okay, thanks, Donald, for your question. That was great. Okay, so it looks like we can draw the curtains down. Okay, so we have Nana Aisha. Okay, Nana Aisha, please go for it.
I just wanted to, good evening to you all. I just wanted to find out if she can share her slides with us.
Sure, I'll do that.
Okay.
I can get the emails from Linda. Yeah.
Yeah, oh, I can also just share with everyone. So usually I
Oh,
include
I'll
them as
share
a
it.
link to the recording on YouTube as well.
Great,
Yeah.
great.
So you don't
Okay,
have to
I'll
do
check.
all the work.
Okay,
Yeah.
thanks. Yeah.
Okay.
Mhm.
All right. So any final words from you, Constance, as we end our session for today?
Um, so what I'd say is for you to have to assess impact the right way, and also just ensure that your impact reaches the right audience, ensure that you include stories. Just like I mentioned, a human-centered design or human-centered outcomes does a lot more for your reporting than you would imagine. It gets donors uh, giving you more funds. It helps you to scale. It helps you get so many other approvals that you will not get usually if you have just raw numbers. And it brings the why to the what.
Wonderful. Thank you so much, Constance. Participants present, you can appreciate Constance. You can send her your emojis. You can also react in the chat section of the Zoom. Okay, so before we end, I have a few announcements. So please do well to provide feedback on the session. Would like to know if there are any topics you'd want us to discuss, or if you also want to volunteer to be a speaker yourself, you can also indicate in the form and we'll be glad to connect with you to take the conversation further. And then I've also shared a link to our handle on X now. Yeah, you'd see women underscore RMEL. So you can go there and see the page and follow. And then you can also follow us on LinkedIn. So I've also shared the link to our company page as well. And then for the benefit of those who have not been with us or been participating in these sessions from the beginning, I will also put in our channel link on YouTube, so you can always access and then watch our recordings. So our previous recordings and also the recording from today will also be uploaded there as well. I will share that in a bit. And yes, please follow, do well to subscribe and also share with others as well. And then there's also an announcement from I'm sharing on behalf of one of our former resource persons. So for those of us who probably were here in July of last year, we had Joy Bonsu Schmutz. So she did a session on innovative leadership for high performing teams. And she has a book that she has written, which is titled How to Learn Anything Digital, Build New Digital Skills with the H2L Model. So she has this book available on Amazon. So I'll share the link shortly for anyone who is interested. Please take advantage. Wow, that's a very long link. And then she also has the same book available on Selar, Selar. So you can also check there as well if you're interested in getting yourself a copy. I'll also share the link to the session she did last year for anyone who wants to listen as well. Just give me a second. Yeah, it was a very interesting session she did on leadership. So for anyone who wants to tap into her expertise, that's an opportunity for you as well to do that. All right. So on that note, I would like to thank you all for joining. I know some have already dropped off, and yeah, we exceeded our time a bit, but thank you so much for your patience. I think it was worth it since we only meet once a month. Yeah, this is an opportunity for us to connect and to get to know each other better as M&E, our research, monitoring, evaluation. Now we have all kinds of acronyms, but yeah, we are all in the same sector doing great things. So please be on the lookout for our next topic, our next session, which will be in July, hopefully. And today being the last month of June, I'd like to take this opportunity to wish us all a happy new month in advance as we enter the month of July. I know we all have some targets, goals that we've set that we are hoping to achieve in the coming month or coming months as we enter the second half of the year. So best wishes and hope to see you next time. Thank you once again, Constance, for availing yourself. Hopefully this will not be the last time we'll be inviting you to speak. And yeah, we'll be in touch for any possible opportunities in the future. Thank you so much, Constance. Bye for now.
Bye. Thank you, everyone. Have a good night.
Bye.
Good
Good night.
evening.
Sure.